As the novel coronavirus continues to spread worldwide from its starting point in Wuhan, China, there's now increased scrutiny on the public health response and the handling of those infected.
Standing by for us on the line, Jay, please fill us in.
China's National Health Commission said on Friday the number of deaths in China has now reached 213, and around 9,700 cases have been confirmed in the country.
Tonight, New York State now says more than 10,000 people have been killed there. That is nearly half of the more than 23,000 Americans who have died from the coronavirus.
I'm scared. It doesn't seem like folks here are scared enough.
It is somehow unimaginable, unbelievable, that in the most famous city of the richest country in the world, they're digging mass graves for those who can't afford a funeral and for those who died of coronavirus with no next of kin.
A growing number of schools across the tri-state area continue to either cancel classes or move to remote learning.
In-person classes will resume as normal today, but all that will change tomorrow. Like many, they're not taking any chances.
There have been significant new questions about stay-at-home orders, whether the public should be wearing masks outside, and new findings about how the virus spreads.
Hi, my name is Talisha Overby. I'm a graduating senior biology pre-med major from Halifax County, Virginia. How has COVID-19 affected my life? Essentially, it has stolen my senior year. It has left me jobless. I was furloughed from my job about 2 weeks ago, and it has also increased my anxiety level. Many patients with coronavirus disease 2019, otherwise known as COVID-19, have underlying cardiovascular disease or develop acute cardiac injury during the course of the illness. Adequate understanding of the interplay between COVID-19 and CV disease is required for optimum management of these patients. The emergence of novel coronavirus, officially known as severe acute respiratory syndrome coronavirus 2, otherwise known as SARS-CoV-2, has presented an unprecedented challenge for the healthcare community across the world. High affinity, essentially the ability to get transmitted even during asymptomatic phase, and relatively low virulence has resulted in rapid transmission of this virus beyond geographic regions, leading to a pandemic. The first case of the disease, known as coronavirus, occurred on December 8, 2019 in the Hubei province of China. Since then, within a short span of over 3 months, the infection has spread to 177 countries, areas, territories across the world, with above 26,000 cases confirmed and over 11,000 deaths. Respiratory involvement presenting as mild flu-like illness to potentially lethal acute respiratory distress syndrome or pneumonia is the dominant clinical manifestation of COVID-19. However, much like any other respiratory tract infection, pre-existing cardiovascular disease and CV risk factors enhance vulnerability to COVID-19. Further, COVID-19 can worsen underlying CVD. The review is aimed at providing overview of various CV manifestations in patients presenting with COVID-19, the impact of pre-existing CVD and new onset cardio complications on clinical outcomes in these patients is also discussed. Since our understanding on this subject is only evolving at this stage, the information discussed by my colleagues is based mainly on the limited early experience with COVID-19 and learnings from the previous coronavirus illnesses named as SARS and Middle East Respiratory Syndrome, also known as MERS.
What was once a busy and popular street and now appears to be a ghost town. And as of now, it is predicted that most non-essential businesses will be out of work. Take a look. Thank you for tuning in, and I will see you later in my report. Again, this is Bailey Post reporting live from Basil Bailey Salon.
As my fellow colleague Talisha Overby talked about earlier, I will now continue the effects and methods of COVID-19 and its relation to cardiovascular disease. The more severe of COVID-19 are characterized by acute systematic inflammatory response in cytokine storm, which can cause an injury and result of multiple organ leading to multiple organ failure. Studies have shown that high circulatory levels of pro-inflammatory cytokines in patients with severe and critical COVID-19. These altered myocardial demand supply with coupled hypoxia is caused by acute respiratory illness and can impair the cardiovascular system. This can also lead to acute myocardial injury as stated earlier. Systematic inflammation as well as increased shear stress due to increased coronary blood flow can cause a plaque rupture, resulting in acute myocardial infarction. There are various antiviral drugs and corticosteroids and other therapies that are aimed at treating COVID-19. However, these new drugs and new antiviral things can also have a deleterious effect on patients with COVID-19. People with COVID-19 can have an underlying disorder or underlying myocardial disorder that can in return have a negative effect on them. There is a particular concern about the hypoglycemia in COVID-19. Patients with pre-existing CVD appear with worsening clinical outcomes. Acute myocardial injury is the most commonly described CV complication in COVID-19. However, now, as we are continuing to aiming for new treatments for COVID-19 patients, it is caregivers' duty and all essential health workers to make sure they uphold responsibility for their patients and themselves. It is their responsibility to protect themselves by either wearing a mask to cover their face to protect themselves not only from themselves but other patients as well. This will help lower the infection and the spread of COVID-19 to people with potentially out there. Therefore, all healthcare personnel engaged in the care of COVID-19 must observe the necessary precautions as well. All of them should be trained in donning and usage and doping of the protective system and protective equipment in the hospital. This means properly cleaning, properly storing, and properly wearing a mask for a certain amount of time before switching that out for a new one. Rapid training and management of these patients is critical. Not only is it to allow efficient utilization of healthcare resources, but it's also to minimize the exposure to caregivers. There are already reports highlighting delays in delivering acute cardiac care due to the extra precaution that needs to be observed to view the COVID-19. Efforts should be made to minimize such delays. A strong emphasis is placed on avoiding unwarranted diagnostic tests, which means that caregivers and now essential workers are now prioritizing which patients they now see and which patients they will test. Additionally, various antiretroviral drugs have a significant interaction with cardiac drugs, which needs to be considered an appropriate dose of medication done. Thank you for tuning in. This is Bailey Post, and now I'll pass it on to my colleague, Kyla Newell.
Hello, my name is Kyla Newell, and I am reporting from Hampton, Virginia. And today I will finish the discussion of how COVID-19 has an effect on patients with cardiovascular disease. So as my colleagues probably stated previously, approximately 80% of COVID-19 patients will develop mild flu-like symptoms that can be managed at home. But what about the other 20%? So the other 20% will develop more serious symptoms such as pneumonia, and that's usually the cases we see on the news daily. And this requires them to go to the hospital, and a quarter of those cases usually require ICU level care. So how does this affect a patient with cardiovascular disease? So someone with pre-existing heart disease who becomes ill with COVID-19 may suffer a heart attack or develop congestive heart failure. So this rapidly worsens of cardiovascular health is likely due to the combination of the severe viral illness and its increased demands on the heart. So things like fever causes rapid heart rates, for example, compounded by low oxygen levels due to pneumonia. So in addition to the increase in these heart problems, a more unusual condition called myocarditis has also been observed in COVID-19 patients. So although respiratory illnesses is the dominant clinical manifestation of COVID-19, the burden of the illness implies that a large number of patients with COVID-19 will present with pre-existing cardiovascular disease or even develop new on-site cardiac dysfunctions during the course of the illness. So considering this, the current understanding about the interplay between cardiovascular diseases and COVID-19 is rapidly growing. It is therefore highly desirable that the future studies on COVID-19 specifically describes incidents, mechanisms, and clinical presentations, and also the outcomes of various cardiovascular manifestations in these patients. So the diagnosis and the therapeutic challenges posed by the concurring of these two illnesses also needs to be adequately studied. And so, according to CNN, recent news that there's over 600,000 cases of the coronavirus in the United States alone and over 24,000 deaths. So it is important that we keep following the social distancing, and also we are wearing personal protective equipment. And we're trying to do this just to lower the numbers a little and get everything, back on track. So yes, thank you.